Boom. Here we are.
Hey.
We are officially in the virtual end of the podcast. So, YouTube, social medias.
Yes.
What else are we doing?
Working on a new platform.
New platform. What's our platform?
Well, we were working on Twitch, but we switched over to this new one that also helps us with YouTube.
Yeah, so we're using
basically
OBS.
YouTube.
OBS.
Okay, but YouTube, right?
Yeah, YouTube for the official, hey, we're going to get you some videos and training stuff.
Yes.
Ultimately, just give the audience a chance to actually see how we interact and how our table talk conversations go. We would like to see our viewers and members have that feeling they're actually here with us. You know, so this is going to give us a chance when we do live videos, we could actually interact with their chats and answer questions as we go. You know, we could even do a series or an episode where we're doing a Q&A, you know, and playing a meet and greet with the members, stuff like that. And then Dan, you and I were kind of talking about doing the video segments of, hey, 30 seconds to a minute of training of the day.
Yeah. Absolutely. Yeah, whether that's pulling out a tool, doing some medical scenarios, firefighting skills, anything. Yeah, we want to put out some training to the viewers. And as Vince already said, we want to hear from you guys. So if there's any training you want to throw in and you want to see or provide, this is where it's at. Bring it to Within Thin Lines.
Oh, yeah. Outstanding. So without further ado, let's knock this out. So our first video, so to speak, our first intro to this realm of virtuality.
Virtual reality.
No.
VR.
Not quite.
That's like where you get the goggles on. They could actually. That would be cool if we actually do that, right? Man, I don't know. That'd be kind of weird.
You can control Dan.
Yeah, right.
you like the goggles thing, you know, with being a flight medic and all that.
That's true. I do enjoy that, and perhaps I don't know. Perhaps that's something we could play around with.
Oh,
so
yes.
We'll see. But this first video, I figured we kind of trial and error on. Specifically, could give us a chance to talk about different realms and different ideas. In specific, medical, right? Law enforcement, stop the bleed, trauma, and what else? I guess scene sides up. You know, how to actually perform an actual scene sides up, and how you could prepare yourself, kind of like in our podcast episodes before about community preparedness. It's also how you prepare your own stuff, your own gear, your own equipment.
What to carry, what not to carry.
What to carry, what not to carry. Exactly.
How to carry it.
How to carry it.
I think it's important to note here, too, it's easy to quarterback this stuff, right?
Yeah.
And
so we're not here to shame anybody. Just so this is clear, we're not here to shame anybody. And the Monday night quarterback type thing, it happens anyways, right? And not in a bad way. And sometimes there's really good videos that we want to just elaborate on and say, hey, that guy did an amazing job, you know.
Mm-hmm.
So we're gonna look at the good stuff, maybe some of the bad stuff, but nothing in the lines of shaming anybody.
Right. We're gonna praise the good, but also we're gonna take the bad as an opportunity for us to train, and that's what we should be doing in real life.
Yeah.
You know, whether you had a good call, you had a bad call, you should be debriefing with the crew
for yourself as well.
For yourself,
it's it's not just the crew or anybody. It could be you.
Mm-hmm.
Hey, what did I do good? What did I do bad? You know,
right?
What can I improve on later on?
How do we bring this back to our chiefs and officers and possibly make this or change protocols, or we could change how our layouts are? What kind of things should be issued to our police officers?
Yeah.
Right. And kind of bring the points. Dan, we talk about ketamine so much, and now you're realizing, you know, some of the facts about ketamine. You're going back to your home, you know, department and saying, hey, medical control, let's have a conversation about this stuff.
Yes.
At least how it could be written a little better, if that makes sense. So. But yeah, in specific, this is a video, and to everybody out there, just be mindful. This is graphic, both visually and auditorially, I guess is a good way to say it. So
this is one of the good things with our new platform that we're trying on too, is that you can see the video that we're watching.
Yeah,
and you can also tell us what you see, what you don't see, what you want to see. You know, and if in the future live, then you can talk about it as well.
Yeah, how pretty much you could relate and what you would do. And we want to hear back from you all. You know, how would you respond to these situations? What are your perspectives on these conversations we're having? And if you find any videos that you actually want us to, you know, drill on, share it with us. You know, reach out to us at stay@wtlpodcast.us. And then eventually we'll talk about the whole cadre system as well. You
Yep.
know, at the
Yep.
end of this
A little bit towards the
series. Yeah, a little towards that. Well, let's knock this out. So I'm going to be skipping around the front end, so to speak, just to get to the highlighted points. But obviously, this is a body cam from a police officer responding. So he's racing to it. And I believe the call was dispatched as a situation within the zoo. I'm not really sure all the details of how it was toned out. It would be nice to hear that in the beginning because your scene size up starts off with the tones, right?
Oh, yeah.
Stuff like that. So
With your box. Usually
yep,
you call it
with the box. Yep. So I'm going to skip forward just a little bit until we get kind of the nit and gritty stuff.
Hey, what do you got?
I can call my boss and see.
Yeah, somebody got attacked by the tiger inside. Ripped her arm off.
Oh my, are you serious?
Yes, we're serious. You hear all the lights and sirens? This isn't a joke. All right, where are the tigers at?
Were you able to hear that, Dan?
I was able to hear that. Yeah.
Okay, sweet. So they're called as a tiger
Rip someone's
arm off. It's something I missed in the previous.
Yeah, I didn't,
just to pick it up here though, real quick. Something I may have skipped a little too far forward is so now he's aware of the situation.
Hey, what do you got?
I can call my boss and see.
What is that?
Did you call them off?
Yeah.
Right about there. I think it was as he's going in. Further into the video, when he's going in. He asked for assistance from the city. I think this is the sheriff, is that correct?
I think so.
And so I think he called them out towards a little bit further in. He's walking into the city.
Yeah. I won't spend too much time in this part, but in specific, what I'm looking for is there is a moment where this officer gets on to his dispatch and said, "Hey, you can slow people down, slow off response, that kind of stuff." So he's aware of the situation and some mindset of what the potential could be, and he does take the opportunity to kind of slow people down. And we're going to see why and how that could be detrimental. So
You cancel the city.
cancel
Hey,
too.
you guys can cancel, bro.
See?
Yeah.
Told you it was morning.
Nope, we're good. It's inside. Make sure they know where we're going. Hey, anybody else coming can slow it down.
Tiger is right over here.
Where would they be able to put their arms there?
It would just be right at the fence.
Where's the tiger at?
Right up here to the right. With the tiger looking at arm out. Can you just hold it?
Yeah, you hear?
Oh my
Hear that
god.
in the background?
Yeah.
Oh my god. Is that real?
Please. Oh my god. Please help me. Echo. Please help me. Please.
Hey, you're gonna have to fucking
Please. Oh my god.
I'm going to pause right there. So what we're looking at is once they do find where the distress was at, they come up to a engagement with an obvious tiger on there. So looks like it's an individual. From my understanding, it was a non-authorized individual who broke that first barrier of keeping the public out, and then I don't know how or what the intentions were, but he's got his arm semi through the cage, and at that point the tiger is hanging onto it. Who knows how long this has been, right? So we could talk about the hemorrhage control. We could talk about the blood loss. It looks like there's some significant blood loss on the actual scene. But, keep mindset of that and the timing of it. Any questions so far, Dan Buscio?
Nah, man.
No, I think I'm noticing this is Joe Exotic's zoo. Is that correct?
Right. Blame Carol Baskins. Awesome.
You got a tranquilizer? No.
I know I'm feeling
You're gonna have to shoot. Alright, just keep a light on. Naples 1 Charlie 10 shots fired. Come here, bud. Come here. Alright, yeah, I know. Okay. You got a tourniquet on you? Hey, I need a light here. Get a light right here. Yeah. Jake. Here. Shine it on me. Jake, come and grab him. Here's the tourniquet, bro. Come and grab him. Here. Where's the arm? No, just grab him and flip him over. You're okay. We got you. Yep, notify the field lieutenant. Get a tourniquet on that arm. Have him respond. I need the light, dude. You're okay. Get the trauma alert going, whoever I'm talking to. You okay?
Oh no.
Naples 1 Charlie 21, 1 Charlie 41.
Get that all the way up.
We got a trauma alert.
Alright, that's good right here.
Oh no.
Undo it. Move your arm, buddy. Move your arm. You gotta turn again. Get that cinched. Get that cinched.
I don't know. I had to shoot it.
Tighten that windlass.
I don't know where I even hit it.
Make that as tight as you can fucking get. 170, 160?
I don't even know where I hit it.
160. Hey, landing zone what? Downtown or Pine Ridge?
Huh?
Hey, you're okay. Hey, you okay, huh? You got you. Want to do it tying down? Whatever I'm with.
Naples 1 Charlie 10. Just advise. Shots had to be fired here.
Thank you. Hey, are you good? Hey, are you good?
Yeah, I'm good.
Hey, move that back.
Yeah, I'm good.
Let's get him on the fucking.
Yeah.
Ready? Is this tight? It's tight. Okay, good. Let me see one more. The other one hurt. Get that thing as tight as you can get it. No. He stopped. Okay. If you can send it down one more time.
I don't even know where he went. We tried, man. I'm saying we tried to get him off.
You did the right thing. I'm not doubting that decision at all.
I don't know. He was pulling him through the fence.
Just get it through the window.
He had his leg in his mouth.
You guys have a knife? Got it. We're good. You got it? All right. And then, yep. Now we're good.
All right, I'm going to stop right there. I wanted you to see the whole thing, and then we'll kind of talk about this here, okay? Dan, with our background here teaching the TECC program, what is something that you are taking that knowledge, and especially something I really emphasize on, and could reflect on what occurred here?
Well, the first thing I noticed was they were getting probably faster than most. They started notifying the proper channels that there's a trauma alert, right? Mm-hmm. So they're going to have that kind of situation ready for the patient. But we drill on the MARCH acronym.
Okay.
Right?
What does that stand for?
Massive hemorrhage, airway respiration, circulation, and hypothermia.
Awesome. And then potential add-on head trauma too for the age. But
trauma.
Yep. But we always emphasize timing, right?
Yes. So you can bleed out within a couple minutes of an arterial bleed. This is time sensitive. It was recognized right away. Tourniquet needs to be used, and the life threat was there. Now, in addition, I would ask you, Vince, as a paramedic, we arrive and the tourniquet's applied. What else are we going to be considering to do for this patient besides getting moving a little bit?
Sure. So yeah, let's. I'm going to answer that question. I'm going to come back to it. I want to talk about that tourniquet though. Because as of March or anything that your policy or protocols, wherever you are as the audience members, obviously follow your protocols. We are just reflecting and having the conversation. But if whether you're doing the HABC or the March acronym, there's a couple other new ones here too. But hemorrhage control should be your primary and should be your concern immediately. On my stopwatch here, that the minute the tiger was shot, so the care under fire phase, all that good stuff, right? The situation has de-escalated to where the risk is not there anymore. He's not under fire. He's not being mauled by the tiger anymore. So you have control of that patient. From that moment to where I heard the last one of the providers say, "Okay, it's good, it's good." It was about 2 minutes and 15 seconds, right? That could be what either saves the patient or is now deceased, right? Those 2 minutes. And we don't know how long this guy's been fighting this tiger. How long has he actually been bleeding? And this could be the last couple pints of blood he had, and it was within those 2 minutes. He immediately went into shock, right? As soon as the tiger was released. You could hear him going into shock. You could see his color, his skin color. And we'll talk about the different stages of shock that we are noticing. And kind of going here, but 2 minutes and about 15 seconds is what we're recording, and there's a couple moments we could talk about here that could lower that time, So in specific, let's talk about. So here's where the tiger shot.
I'm gonna die. I'm gonna die. I'm gonna die. I'm
All right, just keep the light on.
Naples 1 Charlie 10 shots fired.
Come here, bud. Come here.
So I appreciate the fact that we're carrying him out of the X, so to speak, right? Let's make this relatable.
Yeah, I can appreciate that too, but I think I know where we're going with this.
There you go.
Do we need to?
We're talking about how this tiger, there's still a threat here, but what says we can't put a tourniquet on while that arm's even still in there?
Right. Yeah, okay, I could give you that.
Yeah.
And that's a good perspective.
Right. It's up high. We're kind of away from the mouth. Like, let's be aggressive with it. Let's put a tourniquet on and tighten it.
There's
work
a cage.
on getting that arm out of there.
You know what I'm saying? There's a cage. He's already out of after he shot him, right? They don't really need to move him right away. I mean, in my opinion. What do you think about that? I mean, there's a barrier between them. So long as they move him just a little bit, they can treat him right away instead of bringing him all the way over, throwing him over the fence, the second barrier, or the first barrier, I guess you could say. You know what I'm saying or no?
Yeah, I do. I could
think that was a little bit of time wasted there, in my opinion.
Sure. And I guess in the sense of the tourniquet while he's being mauled, though. Let's make this relatable to what we do regularly, and it's fighting fire, right? Do you start looking at overhaul before the fire is out?
No.
Right? Do you start treating GSWs while they're being actively shot? No, right? So ideally your priority should be, it's like, let's talk about,
Come off the X.
Right, how do you treat a burn patient? You stop the burning first, right? You stop the flames. You put them out of fire, and then you treat the burn. With this instance, I would say, could you possibly put a tourniquet while he's still being mauled? Yeah, sure, right? But with all the dynamics on this, it's like you need to stop the actual, injury.
Yeah, right.
So stop the tiger, and then immediately think about putting a tourniquet on. And if we make this relatable to TECC, the protocol for care under fire is you get to the casualty, right, after you gain fire superiority, right? So you've gained, you're being offensive towards what is attacking you. Once you gain fire superiority, you look for massive hemorrhage, you put a tourniquet, you drag them out of the X. That is all care under fire is, right?
Yep.
So immediately, if you want to make that relatable to what occurred, as soon as that tiger's letting go, that first firefighter, provider, whatever, you could put a knee on that axillary area. You could put, make a tourniquet, whatever, do the C-clamp technique, but stopping that bleed right then and there until you get a tourniquet, and then think about, hauling them away from the X, so to speak. That makes sense?
Absolutely.
So I do like that perspective you brought on.
Sure.
But it's a mindset as a collective, we should be thinking, stop the fire, then treat the patient.
Yeah, absolutely. I think it was a view, but right, like as I'm sitting here watching, putting myself in that scenario, it's like I kind of want to get that tiger head off of there.
Right.
let's
Right.
let's get out of here.
And this is something we're probably never going to see in our careers. You know, is it possible? Sure. Do we live by a zoo? Yeah.
There's
okay.
some real angry
do.
dogs out there,
Yeah.
Vince.
That's true. That is
Real
true.
angry ones.
That is true. I have 2 vicious pit bulls upstairs that want to bite my face off every time.
Oh man.
Oh, absolutely. I mean, I do have pit bulls. They're great dogs. So let's go back to the video here.
Yeah, I know. Right here. I'm gonna put my tourniquet on you. Hey, I need a light here. Get a light.
So I got a firefighter provider who's dragging the patient out. I love the technique, right? That's probably the best way. And then we also have a firefighter provider on the other side of that first barrier looking for the tourniquet, and he's asking for, hey, I need light access, right?
Mm-hmm.
What is he looking for?
Jake, shining on me. Jake,
Tourniquet. Right? Hey, Dan, where do you stock your tourniquet on your first in bag?
It's going to be on the right side pocket.
Oh, I like how you know exactly, right? Is it in or is it out of a plastic bag?
100% out of a plastic bag. It is staged. I'm telling you, it might be a nerdy thing for some, but I stage the tourniquets the way I want to deploy them. They're ready.
Yeah?
Yep.
Okay.
100%. You could ask my crew.
I like that, man. I like that. And what kind of brought that to fruition?
Honestly, training and having to use one at one point where it was still in the package, and it was very inconvenient to have to remove that out of the packaging. I mean, but it was mainly because I had learned it in a training, and it was more effective.
Sure.
And, yeah.
Awesome. We lost Busho here. I'm trying to figure out what happened.
I don't know what happened, man.
Where'd he go?
You lost me. I don't know. I did not do anything.
What happened to Busho?
That's all right. Just keep going, man. If you can hear me, or just do that for now.
Okay, sounds good. Yeah, we don't need to see Busho anyway.
I have a face for radio. Not so much a face for Twitch, or I mean,
So we're struggling to find the tourniquet. Whose tourniquet do we end up using?
police officers.
Police officers, right? I can appreciate that. Is this his tourniquet? Who knows?
Most likely.
Right? Is this a tourniquet that is dedicated to casualties, right? We see a lot of officers carry tourniquets that are actually embedded in the holster itself. And ideally, maybe that's for casualty, whereas I don't. Sometimes they have IFAKs or other means of medical equipment underneath their plates that are dedicated and should be dedicated to the police officer, right? Hence the purpose of an IFAK.
Where's the arm? No, just grab him and flip him over.
I need you 961.
You're okay. We got you.
Yep, notify the field lieutenant.
Get a tourniquet on that arm.
Have him respond.
I need the light, dude. You're okay. Get the trauma alert going. Whoever I'm talking to. You okay?
Oh, no.
All right. So what is the? I'm assuming that is the lead paramedic, right, or provider. What is he starting to delegate?
Get trauma going.
Okay. Why is that important?
You don't know how long that guy's been losing blood. For one.
Okay.
It's
Dan?
so significant. Just thinking about it, right? Our response times too. We're not even including our time to get there, and you time 2 minutes and whatever seconds, and then 4 or 5 minutes for us to get there. I mean, who knows? So yeah, it's preparing the doctors and trauma surgeons for when we come in the door. There are able hands ready to receive, and there's blood ready. That's what they need.
100%. Right. You have your trauma surgeons that are prepared. All that good stuff. That is the importance for it.
Oh, no.
Naples, 1 charge 21, 1 charge 41.
Get that all the way up.
We got a trauma alert.
All right, that's good right here.
Oh, no.
Undo it.
All right, so I'm not hating on this guy. I'm not here to insult, and I'm not here to criticize her by any means. We are just trying to make this a learning moment. Again, I'm assuming he's lead. I'm assuming maybe he's in some sort of FTO position. Who knows?
Yes, that's what I thought.
The one thing that I'm kind of having a hard time with is that he takes a lot of time on like coaching, and kind of helping another provider put a tourniquet on. When we're this critical of a trauma alert and we're this much into blood loss, and I get it, the environment is going to change and you get tunnel vision and whatnot, and I wasn't there, so we can't really play too much backseat quarterback. But in FTO position as well, there's a moment for training, and then there's a moment saying, hey, I have to take over. I'm going to take this over, and then we could talk about it later and why. Especially when a life is at that much threat. If you have a student who missed an IV for the 4th time, you're not going to have them do it a fifth. You know what I mean? It's kind of one of those things. It's like, all right, I'm going to take this over. I'm going to do an IV, and then let's talk about it later on.
Training.
And I could tell he's stepping back, and he's trying to focus on their overall scene, which is great for scene size up. Right? He's delegating the trauma alert. He's delegating to get more staff out there. He's also, interacting with the police officer, that kind of stuff. But the mindset should be, hey, let me take over. Let me put this tourniquet on right. I can't make this a training moment right now for this kind of casualty. Any thoughts?
Nope, I agree.
I would.
What's that?
No, what I've said this before, but preparation, even for a firefighter, I feel like you should have what you need on you for the most part. I heard two things there. So the first thing I heard was, hey, I need this light over here, right?
Mm-hmm.
So he didn't have a light. Okay, I carry a flashlight. Don't care what time of day it is, where we're at. I carry a flashlight because you always need one for something.
Sure.
Number two is I always carry a knife. No matter what it is, I always have a knife on me. I heard him say, "Hey, I need the light over here," multiple times, and especially if you're working nighttime, you should know that you need a flashlight. You're going to dark places. And number two was, "Hey, I need a knife. I need a knife." I kept hearing that. So I said, "Well, where are your trauma scissors? Where's your knife? What do you carry on you that you can use to cut whatever you need to cut? Or if you don't carry it on you, then where is it in your bag?"
Sure.
The way that Dan said, he knows where his tourniquet's at. Hey, Dan, do you know where your trauma shears are? Right? Do you know where this is at? Do you know where that's
Same
at?
spot.
Exactly. See? Okay, so you have it ready to go. So how come? Again, it's understandable. Maybe that guy is a new guy, and he's teaching them and say, hey, this is where we keep all the stuff. But that's why inventory is very important. That's why knowing what everything
my hope
is.
for this guy is that was his takeaway.
Yeah,
sure.
And I'm sure
this
that
is maybe a big call for him, and his takeaway was, you know what, I'm going to purchase a flashlight,
Yep.
and I'm going to have a knife.
Yep.
Right? Maybe that was his takeaway, and that's my hope.
But that's and not good that happened there, but it's good that it happened because now I was like, oh shit, now I have to, I should bring this, I should do this, I should prepare this, I should have this in my bag, I should know where this is in the bag. It's important, man. That stuff is really important.
100%. Talk about the materials and equipment that you have at hand, and then just drilling on it. And like you said, Dan, if this is anything, maybe this is an eye opener. Have your staff go through this kind of stuff. And in my mindset, for when it comes to a tourniquet and whatever your placement is, it should only be one barrier for you to get to it, right? So if it's in a pouch or it's in a holster, it should not be in your bag and then you get to unzip a pouch. And no, that's too much. One barrier at the very minimum.
Same with the PD. I got to call it out the way I see it sometimes. Don't keep it in your car. I don't want to hear that some of this stuff is in I got it in my car, No, it should not be in your car. It should be on you 100% of the time.
100% of the time.
You had his light. You had his tourniquet. So that was the one thing, too, is like if you're a cop, do you carry two? We talked about it just right now a little while ago. But do you carry two tourniquets? Do you carry one tourniquet? I used to carry two. So, I mean, I had my good one for me, where everybody can see it, but for me. And another one was for someone else. It was still a good tourniquet, but it wasn't as good as mine.
I've gone as far and have had some military and law enforcement guys drilled because they were carrying tourniquets and like the extremities and one in their ankle, and it's like, wait, why are you carrying it in your ankle? And they're like, well, it's easily accessible. Whereas I got all my other plates here and all of my other equipment. It's like, okay, maybe not so much in the civilian world, but in the military world, if you lose your leg, there goes your tourniquet. You know what I mean?
Right.
Well, here,
so
I'll give it to you. I used to carry one on my ankle, but it wasn't for me. It wasn't for me.
sure.
It was for somebody else. I can reach down, grab it, and give it to somebody else. Mine was on me. On my shoulder. I had it right here so I could reach it with both hands.
So if you were taking fire, right, as a law enforcement officer, and you've got yourself prone behind some sort of barrier, can you accessibly reach down your ankle and grab your tourniquet?
That's not for me, so I wouldn't. I just said that wasn't for me. That was for other people. I would carry it in my ankle for other people.
Hey,
Mine was reachable from both.
Let us know what you think.
Yeah, there
yeah.
you go.
Ah,
there
Honestly,
you go.
let
This
us know
guy
what you
knows
think.
what we're doing.
It's good for discussion, man. This is all good.
What do you guys
for
do?
discussion.
What do you all do, and how do you all supply it?
I will say that I feel like he had it ready to go, which was good. and you had it in a proper position. Man, I've seen people with plastic on their tourniquets on their belts. Like, like, dude, what are you trying to do? You trying to keep it so it's nice and clean or whatever? Like,
I've seen people with duct tape belts.
Oh.
Let's go with that.
Duct tape
Those
belts?
are my favorite.
Oh. We could talk
That's
hours
awesome.
about the proper
I
thing
know,
of
I
tourniquet.
know.
And we will get there. We will talk about
I
the March acronym in a little more detail.
red
So
tourniquets.
going back to the video,
Move your arm, buddy. Move your
so
arm.
they're working on a tourniquet. There's that question about lighting.
You okay, right? You want to do the little time down? Whatever I'm with.
Naples 1 Charlie 10. Just advise. Shots had to be fired here.
Appreciate the communication. Officer's looking at something at his foot. Maybe he,
Are you good?
ran out of the socks.
He's looking for his foot tourniquet.
Ankle
right.
tourniquet. Get it right,
Right.
Dan.
Just then and there, you do hear the medic say, "Are you good?" And he's actually talking to the police officer, and that's something I will take a lot of pride and respect to the provider. It's taking that moment to check in with your responders, right? Check in with your officers, check in with your medics, your firefighters, the staff members. And realistically, a tiger is still in the cage, but somebody should still be kind of mindful. It's like where are we in location to the tiger?
Yeah.
Right? Is that thing going to come back at us? Is this going to cause another thing? Is a cage? Is there an opening somewhere? Is this tiger on roids and now he's going to crawl through the through the cage because you just upset him with a bullet? Who knows?
Is this tight? It's tight. Okay, good.
Still working on the tourniquet.
Well, we talked about it last time.
We tried,
I think he met up with someone who was not in charge of the zoo, but worked in the zoo. My thing is, how do you not know what's going on? Because she didn't know in the beginning. He said, "Oh, you think we're playing with you with someone? What's going on?" He goes, "Don't you see all the lights?" And someone got their arm ripped off by a lion, or I think that's what he said.
I think in the video, and I didn't catch it before this, but I think in the video the officer said we got a text that somebody was getting their arm.
Oh, is that what it
off,
was?
Right. So is that something like, "Hey Siri,
Third party.
text 911" or whatever, or a third party? Who knows?
But like if you're there, I think you had said it. It's dark. It's dark outside. Ask the people who are working there, like, hey, can we get some lights going?
Oh
over
yeah,
here?
there we go. Use those as resources, right? Light up the area.
Yeah.
Turn up
Turn
the
them
zoo.
on. Yeah.
Right. Get some music playing in the background.
Let the elephants out. No, I'm just kidding.
There you go. There you go.
I'm saying we tried to get them off.
You did the right thing. I'm not doubting that. You guys have a knife? You guys have a knife? Got it.
Working on the knife.
I don't need his vital. Go ahead.
Just
All right, so we're gonna start.
1, 2, 3.
Patient carried. Are we worried about C-spine?
Not at this point.
All right, when you're at the hemorrhage and life situation, C-spine is not
Just start
really
moving.
kind
I don't need his
I
vital.
think
Go
there was
ahead.
too much trauma to the head there. I mean, he was. Well,
exactly, yeah.
Yeah.
But who knows?
Yeah, you never
knows?
know.
Dan, what are you looking at here? Is this a sick patient, real sick patient?
Oh yeah,
Real sick patient.
I heard them talking about some guy wanted vitals, and the other guy's like, "Yeah, I don't want vitals right now."
Yeah, let's go.
I agree with that.
Let's go. 100%. I don't need vitals right now. Right now, I could
sometimes
probably
you
tell
don't
what the vitals are.
Forget about your
Right.
tablet.
Yeah. Can we get a signature, though? Can you walk?
What is your name?
Right.
Seriously. So they're getting ready to load,
just
and they haul. Also, I don't know if we skipped through it, but there is a moment where they, when the provider is trying to work on straps, because right now this patient's
Start
not
moving. Just
strapped
start
down.
moving. I don't need his vital. Go ahead.
So just start moving. Don't need vitals. Do we take the time to put the straps on before we load up that cot?
I would say yes.
Why?
You could fall, man. What if you're coming onto rougher terrains and trying to get past, and now you gotta lift them up and stuff, and that, man, those things are weird. Like the
Listen, slow down.
littlest pressure to one side will flip that thing over.
Yeah,
We're talking about the gurney.
secure the belts. This is where you got to slow down. If you got that tourniquet placed on properly, we've solved some big issues already.
Yeah.
Okay.
Yeah.
So it's on. Let's put some straps on. We're gonna get moving, but we've stopped the bleeding, right?
Mm-hmm.
And once we get back into the back of the box, that's when we start getting aggressive and moving forward with TXA, getting large bore
So I think
IVs,
that's
things like
important there. Stop the bleed. Put the straps on.
Exactly. exactly. Stop the bleed, put straps up, just like Dan said, slow down a little bit.
Yeah. Worry about the vitals later. Like
You seen those videos and TikToks out there of providers somewhere and they forget to put the straps on? A penny will knock over that cot. You know what I mean? It'll haul through anything, but its own strap will knock it out. You know what I mean?
So funny.
It's
so
crazy
funny when it doesn't happen to you.
It's crazy, and then that tips the patient over, and now the patient's rolling off the cot, and now you got more trauma. I mean, like I said, just take the time, and figure it out. So I do appreciate they did keep the patient a little lower. High stress, high speed, keep the patient lower to the ground, especially with unknown terrain. That does make it less top heavy and less prone to falls or whatnot. I don't know if this is a IED or not IED. Jeez. AED.
AED.
Man, IED.
The guy's arm's already gone.
They're right. Who knows? But that's again, it talks about your equipment. You talked about lighting, and let's go into the rest of the care. What else could we be doing for this patient once we get into the ambo? So we did the trauma alert. So we're calling the hospital saying, hey, this is what's going on. They do talk about an LZ, which I can respect, for medevac. This is something where I don't know the distance of trauma or a level 1 center. Sure. Is this going to
I'm calling a helicopter? Yes. Well, level 1 trauma center, depending on where you're located at. But 2, time. Okay. 3, blood.
Talk to me about that.
Well, this patient doesn't need a mass amount of fluids.
Yep.
They could use some TXA, which helps promote the clotting process. But that's what they ultimately need is blood. They've lost it. They need it put back in their body to continue to live so their organs can keep going and all that. So,
are you using Kool-Aid or anything like that?
Kool-Aid?
Are you making Kool-Aid with IV normal saline?
Yeah.
Right.
That's what happens.
Oh, no.
Right.
No, but that's what
bring a can of Kool-Aid.
So for you, Vince, right?
Yeah.
Me and you were working. We put him in the ambulance, and you're going to be delegating. What do you want?
Yeah, 100%. Delegation. So I need IV access, large bore. I want to go by.
Right, I'm on it.
At this point, I would say normally bilateral, but obviously one arm is cut off, so don't start an IV on a tourniqueted arm. Sure. I've seen that done before. What are other means of access? For this kind of patient, he's semi-conscious. I mean, if I need product,
Intraosseous.
Yeah, if I have to, 100%, right? Be mindful of the pain management, stuff like that, but we have means to do that. I could go for an IV or venous access in the legs, even jugular, at that point. Mm-hmm. So, but large bore, I want bilateral, I want at least 2, something. I'm doing the whole program, the whole package here. So I need 4 lead, 12 lead, all the good stuff. I'm reassessing that bleeding, right, continuously. Anytime we move, anytime we shift, anytime I do any kind of intervention, I should be reassessing my MARCH acronym.
Let's go priority.
Sure.
Right, 4 lead, 12 lead, but I put a couple IVs in for you, right?
Okay.
We got aggressive with that. What's your next call here?
So you got IVs, reassess the MARCH. How's my tourniquet looking? I see they're talking about maybe cutting clothing. Ideally for in the X, I don't need bare skin for a tourniquet right off the bat. I just need objects off, so pens, notepads, all that good stuff. I could put it over clothing. That will stop bleed. If this is over clothing, where I'm looking at the picture here, the frame I stopped, now I could possibly take the time to reassess and maybe get some of that clothing out. Protocol or the standard for tourniquet is if my first tourniquet's not working, I attempt it once. If that's not working, then I'm going to add in another tourniquet just below it. So pretty much you're piggybacking your tourniquets. I'm not taking the time to make this a hasty versus deliberate, and the difference for hasty is high and tight always, no matter where the injury's at on the extremity, whereas deliberate is more about the 4 inches above the wound, not over the joints, that kind of stuff. But that's not the importance. I'm taking a mental note. I want the airway. So what's my airway like? Do I need to take his airway? Do I need assist with ventilations? Looking at this kind of shock and this kind of bleeding, I'm probably going to get ready to either get someone delegated on BVMs, high flow oxygen, and then potential get ready for my intubation. So I want my intubation set ready, open and ready to go. I already got a tube size. I want that all figured out. Do I have to work about medications about fully paralyzing and sedating this patient? And be mindful of your hemodynamically unstable patients about what drugs you're going to use. Hence my care or my drug of choice, and this is a demo vial, so for haters, don't hate. Okay, I'm not stealing ketamine, but we are going to talk about that.
I was waiting for that to come up.
Right,
when you're gonna go with.
we are going to talk about the ketamine product. You know, the fully paralyzed and sedated patient. But this patient, he needs blood.
What about a blanket?
A blanket. There you go. There we go. We're talking about the March acronym, dude.
I love it.
Priorities,
I'm
man.
just making
We're
sure
getting
you're gonna throw that in there if you want.
We're getting there. So after my airway's taken off, you know, what's after A there, Bushio?
After A,
And the March acronym.
circulation.
Respirations. Right? So
Oh,
I
see, I
got
don't
my
know how to
airway
spell.
secured. It's okay. I'll say it in Spanish.
There you
Airway
go.
secured. R, I want the respiration. So we're either going to be bagging. Is this a critical care transport? Can I put him on a vent? That kind of stuff. But with the vent management on a patient who is this significant, I don't think I have time to manage with vet settings. I need someone on the bag, that kind of stuff. So in flight, sure, we're probably going to get ready for that, you know, especially if I get a helicopter here. Now, do medevac helicopters have to take them? Especially, you know, most protocols for medevacs is if you're going to be doing CPR, we're not taking them, that kind of stuff. So necessarily no. You know, if I just want blood, I could call medevac. You know what I mean? They
Yeah,
could
and I
deliver
can take
blood.
you in the back of the ambulance with me.
100%, 100%. Right? They
You're
don't
coming-
always
you're
have to
coming
go.
with me.
They don't always have to go. What kind of landing zone do they have at the hospital? Who knows? That kind of thing. So after I'm giving respirations, you know, I'm thinking about the circulation. Reassessing my pulses, reassessing I'm bleeding, perfusion, stuff like that. You know, cap refill, the whole shebang. Make sure he still has a pulse. Do you guys remember what the standard, and this has some variability, but it's a good rule of thumb about if you got a pulse and radial, carotid, femoral, what your blood pressure might present as?
Right. So, help me out here. Radial, you got a systolic of 80. Is that right?
Yep.
And then, I mean, basically, when you make your way back to the carotid, it's where, right, if you don't have those other peripheral pulses and you make your way to the carotid and you got that, I'm assuming it's pretty low. It's 60. Is that right?
Yeah, and we'll double check on this, but I want to say that radial is going to be your 90. You need at least
90.
a 90 on your radial.
Okay.
Your femoral is going to be your 80, and then if you only have a carotid, then you're 70 or below for your systolic blood pressures. So, but we will double check with that and make sure. But if anybody out there and you have your own technique and what works, you know, again, that's not the standard for everybody because there's so many variability, but that's a good rule of thumb. So I'm assessing that. Do I push normal saline on this patient?
Yeah, you can.
For what reason?
There's really, it's to keep up your, you know, it's not to maintain their blood pressure because it's really not going to work. It's just not going to work. But it can, I'm trying to use some big verbiage.
Now you know
It
how I
creates
feel.
peripheral vascular resistance, or
Okay.
right. It just keeps things a little sustained, but it's not the end all be all.
Right. So normal saline can increase your blood pressure.
It
But
can.
then we could get that increase of blood pressure, but then all of a sudden it's like, how come we don't have an increase in pulse ox? Right? And it's because normal saline does not have the oxygen carrying capabilities like blood does. And that's a reason for blood, is that we need to maintain that blood for the tissue loss or tissue death and then for the perfusion. So yeah, you will see it pushing blood pressure and people are like, oh yeah, we're saving him. It's like, well, you just made some Kool-Aid, you know, you gained his blood pressure, but you're not carrying oxygen. So that kind of thing. So yeah, it's good. Keep it open, at least TKO. Push a little bit here for maybe a standard of 500 just to maintain, to see where we're at, to get some flow in there. And then ideally it's for medication administration. So, but getting ready for 2 large bore IV, because the minute I start my my blood or get my blood, I want to start pushing the blood product for this patient. And then we could go the whole medications of TXA and calcium chloride for that kind of stuff. But that's going a little further in. But yeah, landing zones, that kind of stuff, delegation. Anything else you would add? Oh wait, what is after C?
Circulation.
Head injury and hypothermia.
There we go. So shock, treat for shock, keep them warm, and then treat for head or be mindful of the head injury. So
If your patient's
elevation,
not warm in a trauma, you're killing your patient.
100%.
That's what I'm telling you.
100%.
That's all you got to know.
That is one of the things for the pyramid or the diamond of trauma, right? So we could talk about the coagulation, everything. So the cold patients and whatnot. But yeah, keep that in mind. Hypothermia is something that is overlooked frequently, and then it's just as significant to make sure you're treating that as well. So
That blankie going.
Mhm.
That's blank.
Yeah. Anything you would add? You would subtract? Take away? How was this video?
Interesting.
Interesting, right? Something we probably wouldn't deal with ourselves, but
Right.
it's a dynamic. We're used to GSWs and assailants, but having a tiger, I mean, that's a whole nother
How many
game.
times do you think you can deal with a tiger in your life,
Right. Oh, we forgot the most important thing.
What's that?
When was your last tetanus shot?
Ah, yeah, that's right. That's right. That's right.
Yeah, just kidding.
Yeah, that's right. That's right. But yeah, that kind of stuff, paying attention to allergies and medications, what kind of stuff is he on? So the detail or the description of this person, he was a third-party zoo cleaner, right, who were there to actually clean the zoo. I'm not really sure about the hours or when they were supposed to be there. The lights are shut off. I'm assuming he's not supposed to be in that area of the park. But he was called an unauthorized user, and then he somehow managed to get through the barrier. So who knows what he was doing, what the intentions were.
Life finds a way. No, I'm just kidding.
Right. That should be a concern immediately. The description. So he was. I'm not going to name any names or anything, but it was a unauthorized area of the zoo at the tiger enclosure after the zoo closed Wednesday. He already breached the initial barrier, put his hand through the enclosure fence, and then the tiger grabbed it and pulled his arm into the enclosure. A CCSO deputy responded to the scene. That was his body cam that you're watching, and then had to pull the trigger in order to shoot the tiger. Shoot the tiger or don't shoot the tiger? Do we tase the tiger? What are we doing? What are your thoughts?
Could have tried to tase him. Could have tried to. I think he did a good job. This is my opinion. I think he did okay because at that moment you have tunnel vision. You don't know what's going on. You're trying to take this tiger off as best you can, right? So, yeah, you could have shot your gun in the air, down on the ground. Can you really do that? Not technically do that, make a loud sound. But they were doing what he was doing that already, and it wasn't working. He was hitting the cage, trying to get his attention. Tiger was just not going, just had no, care for him at all. So, yeah, I think he did fine. Could you have tased him? Yeah, maybe. It probably wouldn't have worked.
I don't know the answer to that.
Yeah, then you
That'd
could
be really interesting.
could've
Because some of
tried to
these
tase them.
tasers don't even work on us.
Yeah.
There you go. Right. When's the last time you've seen a study about a tiger reacting to tasers? Right. Can those barbs go through that kind of fur, that kind of skin?
Yep.
Right. Who knows? Sometimes it doesn't make it through a sweater.
Exactly.
So at this point, I
Sometimes
wouldn't
it
even
wmake
mess
it through a
with
shirt. Just depends.
Yep. I wouldn't make
depends.
this point. You're not going to be able to tell
Does
the
he have a
tiger.
taser? How about that? Does he have a taser?
That's
Maybe
true.
he didn't have a taser.
That's true. Right.
Yeah.
Pepper spray, mace. I don't know.
Oh, that doesn't work.
It does.
That doesn't
it
work.
doesn't work.
Those definitely don't work. I'll
Yeah.
tell you that right now.
But the mindset should be like you're not able to try to talk this tiger to let go. You know what I mean?
So
I do
think he
appreciate
did
your
fine.
initials trying to scare him, but at some point it's got to be like, I got to pull. I got to pull
I
that
think he
trigger.
did good. I
Yeah,
think he did.
100%.
He did what he
100%.
needed to do to save someone's life.
100%. And that was the exact description they put in the video, is that he made the decision to save this patient's life. And this patient did survive. Unfortunately, the tiger did not. After the fact, they were able to find, or they got a drone from their sheriff's department and were able to find the tiger, and he was found deceased. So,
Unfortunate.
yeah, but there's the actual scenario. Hopefully, this was something that we've kind of all have something to pull away from the actual conversation. Anything? Closing thoughts, comments?
Be prepared.
This is
Have
first
everything
time
you
for me.
need.
This is fun. I would say just comment, throw some opinions out. I think going forward too, I know we talked a lot about some medically heavy things, but
Yeah.
I'm hoping down the road we can get Dakota in here,
Mhm.
aka Utah.
Oh, we got a video ready for Utah.
Yeah, we do.
But I would
Yeah.
love to have an episode for the officers out there on what kind of things they maybe should be carrying in their vehicles or on themselves. I think it'd be excellent.
Even for them,
Because
even for
You
the
might beat us to
firefighters.
this call, guys. You might beat us to the call, and you might have something that you're trained on, hopefully, and you can use before we get there.
Yep.
I just think you should always be prepared with everything you need. So I'm
Mhm.
hoping those firefighters or paramedics who are on scene,
Even
you
butt
know,
wipes.
are ready to go.
I hate to
All
say
the
it, but
time.
we all have that one guy in our department who's a Batman. He's a Batman belt. He's got all the equipment on his belt and everything. A lot of people shame those guys. I mean, like, you're never going to use that. But when doo-doo hits a fan, who are we turning to? Be like, oh, I know who's got scissors.
We're
I
turning
know
to
who's got a
Carl.
knife. I know who's got
Got all the stuff.
right. I know who's got a flashlight. He's got it all. To me, that's just, is it a brand new guy who likes the hype, yeah, sure. But then the senior guy and whatnot who still carries that stuff, to me, that's a guy who's been through things, or a gal who's been through things, experience, right?
Oh, yeah.
So we could talk about the everyday carry. What are your all everyday carries? What's something that you cannot start your shift with?
Why don't you send us a couple of pictures of your everyday carry on our Instagram there?
100%. So reach out to us, join our conversation. Give us your reflection, what you would have done in this situation. If there were any giveaways or any takeaways from this video or what we said, anything that we maybe you think that wouldn't work, tell us. We want to have you on the table talk and have you part of this conversation. So reach out to us through our email, social medias, all that good stuff. And then stay tuned. If you feel like these videos are actually going to be beneficial for your training, and we hope that it does, and we hope we're able to show you the virtual end. And even get you the short little clips about the training of the day. Like we're going to be doing rope tech ones shortly here. Just talk about a little, how to make it hasty, stuff like that, So, but that is our intentions. That's where we're going to be. And then,
It's good.
Cadre, you want to talk about Cadre real quick?
Yeah. If you're interested in being part of something we have here on Within Thin Lines called the Cadre Group, you can email us at cadre@wtlpodcast.us. But basically, it's just we would love to have people who are interested in being leaders, people who are interested in teaching and making others better, as well as helping themselves and making themselves feel be better as well. And it's a group that we all interact with each other, help each other. We would love to have someone from every state one day. So if you're interested in anything like that, we have more information about that, and you can always just reach out to us on the email I just gave you, the email that Vince gave you, or even on our Instagram, Within Thin Lines Podcast. You can look that up on there as well.
100%. Well, that's it. As we have always said, just remember, through training, through education, through preparedness, the excellence is your responsibility, and hope we could bring that kind of into an understanding throughout the department, throughout your everyday life. So from us all within here at the Within Thin Lines Podcast, we hope that no matter where you are and whatever it is that you do, just stay within thin lines.